Thank you everyone for joining us for the annual webinar. I'm thrilled to see so many IMGs here today, and I hope you're interested in pursuing your medical career in the US. So today I'm very honored to have a panel of our Sarthi students who've successfully matched in 2023 just last week, and I'd like to extend a warm welcome to them as well. Of course, we all understand the challenges and struggles that IMGs face while applying for the residency match. And I believe that the stories that you will hear today by our panelists will be very inspiring and informative. So you will hear unique stories from all our successful students who may have faced obstacles such as old year of graduation, low scores, attempts, repeat applicants, applying to multiple specialties or changing specialties, home country residencies. So our goal today is going to be to provide you with some tips and advice on how to navigate these challenges and how Sarthi helped them improve their chances of success. So hopefully this webinar is going to provide you valuable insights and guidance. And what we're going to do is, as we go through this webinar, it's going to be a marathon session, about 3 hours, give or take, and we'll have panelists come in and go out. We have divided this webinar in various sessions, and we'll have breaks after some sessions, and you can ask questions in the chat or in Q&A. We'll take the questions during break. If you are looking at it on Facebook, where this is being streamed, you can obviously see it, but questions we are going to take only in the webinar. So with that said, like I said, there are various themes, and I will go theme by theme, and the panelists will introduce themselves. So the very first theme for today is the challenges for the old graduates, older year of graduation. And in that, I have Somu and Elsa. They'll introduce themselves and talk about the top challenges they faced, how they overcame, and how Sarthi helped them, and of course tips for you all. So let me just start with Somu. Somu, why don't you introduce yourself and walk us through your journey?
Sure. Thank you, Pawan, and thank you everyone for having this opportunity, giving me this opportunity to share my journey with you, all of you. I know that everybody's profile is different. We all come with different experiences. To give you a brief snapshot of what I have been through. So my year of graduation is the year 2000. Okay. So I'm sure there are some around my graduation. So now to say that from year 2000 till this year, I have planned every single step that led me to residency, that would not be honest of me, right? So what I can say, what I can tell you is I have always had that intention. And I've always taken up jobs, done things that I was able to, that was very focused on my area of residency. So when they asked me, okay, why should we take you after 22 years? What have you done? I was clearly able to say in one sentence that everything that I have done till today is related to this specialty. So I think if you are a few years away from your graduation, you need to take up work, or at least, you need to talk about how everything that you've done is aligned to your specialty. So I worked many years in India, 8 to 9 years in India. I was in the Indian Army for around 6-7 years. I came here, did my MPH. I worked in some international companies, and then I worked here in community and public health for 4 years. And then I took up a teaching job, and in the university, I've been teaching for around 8 to 9 years. And that's how the challenge for the old graduates is, people do not pick up your application unless they know you. And so you have to have a strategy of how people will know you. Unless a majority of my rotations or majority of my interviews that I've had, is because people saw me in person, half of them, and half of them were just appreciative of my application because I reached out. So the good thing about being part of the Sarthi team is you have so many guidance clues, and you have so many ways, so many suggestions that you can make use of. And that has really helped me clear my confusion, because having done graduation so many years back, and having been out of practice for around 12 years now, without doing any residency, having low scores, having multiple attempts, and that is my profile, right? It is really important to clear all this confusion that we have in mind. And so talking to people, being part of this large group really helped me. So that is all I'll say. You mute.
Thank you very much, Sonu. Appreciate your insights. Let's also bring in Elsa now. So Elsa is also a very old graduate. So Elsa, what has been your challenges and how did you overcome and use the Sarthi group?
Yes, good morning. Hello, everybody. I'm older graduated than you. My age, I graduated in 1997. I'm 52 years old. And yes, I agree with you when you say the most challenged situation is they had to pick up your application. For me, it was a big challenge because I moved to this country 5 years ago and I didn't speak English, nothing. So my first step is have to learn a language. At the same moment, I have to prepare my steps. And that's why I have one attempt in my step one. So your mind, when you see the applications, when you see the programs, they say that they want recent graduates, 5 years old. So that makes you feel really bad because you say, okay, I'm not gonna do it here, right? But in that moment is when Sarthi help you with the guidance and a good advice. They tell you all the time, they support you all the time. They check your profile and they tell you, okay, this is your profile, this is what you need. And if you do everything that they advise you, you're gonna be success. So saying that, I apply for the programs where I see that I could fit. For example, programs when they take residents, Latinos resident, programs when they have all graduates. So my application it wasn't extend. I just have a short programs to apply, and yeah, that helped me. That's why I'm here now. I'm so happy.
Okay, thank you very much, Elsa. So now I want to go on with a different profile. So people who have home country residency, a lot of our panelists and in audience, you will have applicants who have home country residencies. They may be switching careers or they start their journey late. So technically they are also older YOGs, but they have home country residency. So we have two panelists here, Anaga and Divya, who have done their home country residencies. So I want to now move on to them, invite them to share their journey, what challenges they faced, and how they navigated this. So Anaga, let's start with you. Why don't you introduce yourselves and talk about your challenges and how finally you matched?
Absolutely. Thank you so much for having me here today. And I'm really glad to be able to see this day when I'm sitting here and I have matched and I'm able to share my journey with everyone. Thank you, Pawan, for inviting me. I would first tell you about my profile briefly. I am an old graduate as well as I have a home residency. I finished my medical school in 2011. After which I completed a 6 years neurosurgical residency in India, and I was working as a neurosurgeon. And towards the end of my training, I had decided to move to the US, take my steps, and I also decided to switch specialties. I was going to apply to neurology. So those were my challenges, the older year of graduation, and more so changing specialty which I'll get to shortly. I worked towards my steps. I created my own timeline, I think, which is very important. At least 2 years ahead of when you want to match, I feel you should decide when to give your step exams and complete everything and get your certification on time. I think that really helped me to have all the documents. I made sure I had USLORs. I tried to get university observerships as much as possible. Throughout this journey, I joined Sarthi early on. I joined in April. I was talking to Pawan before joining, and he suggested that I should join once the previous season ends. So I joined them in April, and I had an early start, I feel, because with their deadlines for CV and PAS submissions, I was able to complete everything on time, which I think is very important. If you're on your own, you're going to procrastinate and things just get delayed, and it's better to have a team that is guiding you on these issues. So that was something where Sarthi really helped me. I was a part of a bigger group where people were constantly discussing things, and that again helped me keep track of when the tokens are out, what are the deadlines and things like that. The most important and the thing that I really loved about Sarthi was Pawan's short interview classes, and I watched them over and over, and I think that really helped me understand how to answer questions in interviews and prepare really well. My scores were in 240s. I see some of you are asking, and I got 16 interviews for neurology, and I'm happy to say that I matched at a university program. And with that in mind, I feel as an older graduate, and when you have to explain a change in specialty, it is first of all important that you believe that you are capable and to have a strong reason. And I think that's where the interview preparation helped me to be able to get my views across to the interviewers and do well in the interviews. Thank you.
Thank you, Anga. Just a bit of a housekeeping for those of you who are asking questions. We will have a slight break after the next session, and then we'll take up questions. But if the panelists want to answer in chat, that's fine, but we will have a break after this. And please direct your questions to everyone, not only to the panelists, because I'll read the questions so that everyone can and then see it later on as well. So now let's move on to Divya. Divya also had a home country residency, and she wants to share some tips as well. So Divya, welcome, and why don't we start with your introduction?
Hello everyone. Thank you, Pawan sir, for having me here today. Thank you so much, and I'm really grateful that I matched this season. And first, I'd like to talk about my profile. So I'm an old graduate. I graduated from my medical school from India in 2015. And after that, I got into a pediatrics residency. And so 2018 was the end of my pediatric residency. And I worked in India for a few years. Then I worked in the UK for a few months before I finally decided I should start the USMLE journey. So it was in late 21 that I started preparing for my steps. And in 2022, that is last year, I gave my step 1, step 2. And then by the end of the year, I gave my step 3 as well. So all of them, I mean, step 1 was pass or fail. So I passed, and step 2 CK and step 3 were more than 235s. So I think what helped me was, first of all, having pediatric residency and applying only pediatric programs, because I had the specific, specialty specific profile already that would have helped me in achieving 11 interviews this season. It is my first season. I got 11 interviews. I'm really happy for that. And I matched into the first program, a university program that I applied for. And the challenges for me was I was a new mom. I had a small baby. My parents and everyone gave a lot of support, but of course, it is always difficult for all those who are thinking that they are new mothers, if they can really do it. I suggest that, I mean, if you, it's always up to you. You have to decide if you can do it or not. It's a bit longer and harder journey, but I think it's, at the end of the day, it's really worth it, especially when you're sitting here after matching. And then I joined Sarthi in August 2022. That is last year. I joined a bit late, I feel, but I thought I should get done with my step 1 and 2 before I can actually start thinking about the application and ERAS and all the things that we need to apply to the residency programs. I did not have any clue when I joined Sarthi in August last year. I didn't know. All I know was USMLE steps, and then there is something called ERAS that we are supposed to do. and my cousin was the one who recommended to Sarthi. So I took her advice. She matched in her second cycle after joining Sarthi. So she gave me a lot of good input about it. So what helped me from Sarthi was that they were really helpful with the PS, the personal statement, and the ERAS application, because you only have a certain period of time, like a month or so, to complete all these things, like the ERAS application especially. And when you're on your own, you may not really know what to do, how to go about it. I saw a lot of posts in Facebook and everywhere else, because you don't know what exactly is happening, so you tend to take a lot of advice from all over random people. So what I felt from Sarthi was there are already mentors in especially the Telegram group, which is really helpful, where there's a lot of mentors. There are a lot of other applicants like me who were asking questions that even I couldn't think of sometimes, but they were helping me passively. I could guess I was learning a lot. There were so many interview questions after the ERAS application, all that ended, that is in September. There were a lot of interview questions coming up that other people faced, and I learned from the mentors' answer myself as well. So even though I was not asking questions myself a lot of the times in Telegram group, it really helped me being involved in such a large group as Sarthi. So I think from Sarthi's point of view, I'm really happy that I took this instead of thinking if I should really go with it or not. So yeah, so I think for all of you who are thinking if it's really, home country residency, if you're older graduate, you think that if you can do it, if it's really worth it, but I think you should go ahead with it, especially if you're applying in the same specialty. It will be a bit easier for you. That's what I felt, because they were all the interviews that I attended, they were all really impressed that I had done so much already in pediatrics, and I was again applying only in pediatrics. If it was some other specialty, if I had gone for family medicine or something, they may be thinking why I'm changing specialty. So I felt my home country residency helped me in this way. I already had a few posters, a few publications. So yeah, this is my advice.
Thank you. Thank you very much, Divya. I appreciate. So now the next session, before we take kind of a break and handle questions, is repeat applications. So there are many of you who unfortunately go in multiple cycles before you match, but that's not to say that you cannot match. So we will have some panelists talk about repeat applicants. I'm waiting for others, but we do have Ritika here, who has a very different perspective, not only as a repeat applicant, but also how to plan this journey in terms of, what should be doing when. So Ritika, welcome. And let's start off with your introductions and then your experiences, your journey and tips.
Thank you, Pavan sir, for giving me this opportunity. I'm sorry for my voice. I'm having a little cold. So my name is Ritika, and I accepted a position in categorical internal medicine residency this year, and I'm very happy about it. So a little background, I graduated in 2015, and then I did a 3-year residency in internal medicine from India. Then I moved to US, and here I did few clinical rotations, and then I joined an academic university as a research assistant position. And I also completed my steps here, and I gave my step 3. So last year I applied, I got few interviews, but unfortunately I could not match. So after getting unmatched, I know for especially people who have applied this year and who unfortunately could not match, they must be thinking now how to approach towards match, like what was deficient in our CV. So I understand that emotion. So my advice would be everything is profile specific. Your profile and your friend's profile can't be same. So you have to streamline your and you have to give priority like what is important, especially suppose if you have low scores in either of the step or you are an older year of grad, I would suggest please take step 3 before the application deadline, preferably, and get a good score on step 3. This year, I felt that programs are looking for a more well-rounded application. It is not only about high scores. If we see Facebook and people writing about we had high scores, but we had less interviews, and people with average scores have more interviews. So there is nothing magic. It's just that those people had something extra on their profile, which the other people could not. And this year I felt that programs are looking for a well-rounded application, not only high scores. I mean, scores are the, of course, most important criteria, and they have filters. But apart from that, they are looking for other things also. So first of all, I would definitely advise, if any of you have low scores or you are older year of grad, step 3 is the utmost important thing for you. Even if you get some interviews and you had low scores and you do not get your step 3 done, at least by the rank order list, then people with similar profiles who have step 3, they will always be ranked higher than you. Then other thing I would advise, because now everything is open, there are no travel restrictions, everybody is getting US clinical experience, I would highly encourage you guys to at least do some inpatient clinical experience, preferably in a university program, because there you work with residents, then you get a LOR from the faculty. So LOR from a faculty, especially who runs a residency program, is highly valuable in US. So I would suggest you guys to do some US clinical experience. Then other thing is, like, I hold an academic research position. I can't stress enough the importance of this position. It had like a great impact on my career because I was in a clinical specialty, and I also got clinical exposure in a university program. I worked as a research assistant, got some publication, and I'm sure that they have gave me excellent LORs. So getting a letter of recommendation from a faculty, especially at a professor level, is golden. So I think that really helped me, and I got 10 interviews this time, and I accepted a position out of the match. So I think that is very valuable. So I understand. And then again, the next thing is, please focus on your CV and PS. Do not delay it till the last moment. Start writing your PS at least from July. Latest by July, I would say, because when we start writing PS, we have mixed thoughts. Initially, it will be a big draft. Then you will, go do some revision later, and then it will become more crispy. Then you will get some guidance from your mentor, Sarthi, like how to approach towards the PS. I mean, you are going to write the PS. Nobody is going to write PS for you, but it's a guidance that Sarthi gives, like how to, write our PS. So, and you cannot write your PS in 1 week or 15 days. You have to give it enough time, and programs read your PS. It is very important. Then CV, writing a crisp CV is very, very important. You cannot, everybody has almost similar experience in your observership, in their home country residency, but how we reflect our experience in a short, crispy, format is very important. So you have to, that's why it's very important to, start writing your CV and PS early, so that you will have enough time, to just make it a crisp version of that. And I would say, please checklist everything that has to be mentioned on CV. Even volunteer experiences are important. Even if you have volunteer experience from your home country, it is still important. Even if you are working in US and you have some time on weekends, please go and do some volunteer, even if you don't have that volunteership. Because programs are looking for a well-rounded application, and you have to do everything that is required. Then the next part is, I would say, is when you will go further around the time, I would say August or even July, August time, start making a list of your programs that you are going to apply. Everyone has their own budget. Everyone has their own profile. Go use tools like Residency Explorer and Frida. See like where your profile is, matching in those tools, and then you go to individual. After streamlining those programs, go to individual program website. See if you are matching their score criteria, year of graduation criteria. See the residents list, like are they more oriented towards IMG profiles or more AMG profile, and that's why make an Excel sheet. Write the name of every program, write the score, YOG, and then you streamline like which programs you are going to apply. I know it is very time consuming, but it's your match, it's your money, and we all have to do that. After that, when you apply, please apply on time. Please do not apply late. And then after that, there will be another part of program outreaching, and Sarthi has really helped me, during this. Like as an IMG, we are not aware of what to do and what not to do. There will be many questions coming like, okay, is this important? Is this important? So Sarthi has like guided me towards program outreaching, and it has really helped me secure interviews. I got replies from emails that I sent. It's not that always I got interviews, but always I got, I got many replies from my emails. So I would say excessive program outreaching is very important, and it can definitely help you secure more interviews. And Sarthi has a closed Telegram group in which we can, like post any of our doubts, and any of the panelists replies within the next 24 hours, which is very helpful. And I also made many good friends during the interview season, and we practiced with each other all the interview questions, and that's definitely helped me. And even the short interview classes with Pawan sir really helped me. Last year I remember I attended their classes, and he was giving me some suggestion like that I have such experience to bring my experience in my answers. And this year I integrated all my experience in my answers, and he really praised me in all my classes that I improved a lot. So I would say that please plan ahead all these things. And I know nobody can do all these things in next 6 to 7 months. So be profile specific and prioritize things like what is important for your profile, and plan your things according to that. If somebody is doing more USC, doesn't mean that you have to do the same number of USC. If you have a good amount of USC last year, if you do not have step 3, give step 3. Maybe you have less USC than your friend, doesn't matter. This is my suggestion.
Thank you very much, Ritika. Before we take the break and take questions for this session, can you spend a couple of minutes about how to increase the confidence, right? I mean, that is one challenge that everyone or most people have. So I know you worked on improving your confidence and not giving up. So can you spend a couple of minutes on that?
So last year when I went unmatched, I made a point that I have to match this year no matter what. I sacrificed a lot. I'm also a young mom, and I made sure that I have to get a position this year. So I worked on the feedback. I talked to you, Pawan sir, and the only feedback that you gave me is increase your confidence and bring your experience in your answers. And then I worked really hard last year. I was in academic research position. I did research. I reached out to mentor. He was so supportive. I attended their, I got some clinical exposure in the university program, interacted with the residents over there. So that increased my confidence by interacting with the residents, by gaining some clinical exposure, by talking to the patients. And then I worked on research. I gave step 3 and got a good score in step 3. So I integrated all my experience in my interview questions. I literally wrote all my answers by myself, and I brought my experience from home country residency, my clinical experience in US, my research experience, and point by point, like you guys have guided, like just bring your experience. So it was like my answers were not that common that we hear on YouTube videos on that. I made a very specific points, like I did this in my home country residency. I did this in my research experience, and which was like like not that common answers that we hear. And that actually, when I got good feedback from you and other people, that really boosted my confidence. So I would say that like continuing involvement in the research and the clinical experience and the talking to patients, talking to the residents, it really improved my confidence this year.
Thank you very much. So now let's do this. I will take some questions and I'll give it to the panelists who have just spoken. So for about 10 minutes, and then we will move on with the rest of the section. So let me just read the questions, and then I'll give it out to our panelist team. So let's see, there's so many questions. Let's start from the beginning. Because I know many of you will have to leave as well. So Somu, maybe the first question goes to you. Please tell us what is actually networking, because people who gave a word for me didn't work for me. How should I approach networking?
Yeah, that's an excellent question, a very important question. So networking, when we are IMGs and we come from outside, one of the assumptions I had initially when I applied first time in 2005, it's like, oh, people will speak for me and they'll make special consideration. It does not work like that in US. Unless the person who is making the decision is convinced that your application is worth looking at, nobody else can influence their decision. So you have to reach out to them directly, repeatedly, in an organized manner with your credentials, and then respectfully, if possible. I know many of you are not in US, but if you are in US, use all the opportunities to go and meet with them, stand in front of them, so that they can see you in person, remember your face. Almost half of my 11 interviews came from networking, and directly from the program director, because I attended where they were presenting. So if they were presenting in a conference, I was there. I asked questions during the conference. They got to know me, and then at the end, I respectfully requested that, listen, I'm trying to get back into clinical medicine. Do you mind if I send you my CV? That's it, right? So you have to be very precise, very short, and not keep on talking about things. So I have to understand the situation, and we'll help you with that, when the time comes about, okay, how to go about doing it. So there are multiple opportunities. I remember one program director tell me that, oh, yeah, I remember. I did not reply. We get 300 emails a day from all IMGs and everybody. And this is the completely IMG program. But she said, like, now that I see you and I've talked to you, I will pull out your application. I will offer you an interview. She promised me that. Right, even before the season started. So networking takes multiple touches, and in marketing, if you read some marketing books and all, they say it takes 7 touches to get 1 response. So Sarthi has really helped me in figuring out, okay, how to approach, what is the template, and how frequently to finish off, because you have deadlines and timelines you need to meet. So yeah, there are various ways of networking, but they should know you personally. You should be able to build a personal connection, whatever reason or whatever way you can.
Thank you so much. Anaga, maybe the next question is for you. And the question is, I think there are 2 questions. A, how do we change specialties? You change your specialties, and a lot of students want to know each one of your specialties. So you switch from neurosurgery to neurology. How should I do that? What do I need to do? Second, there may not be a single answer, as Ritika said, but how many rotations got you 16 interviews? I don't know if there is a right answer to this, but let's talk about how you changed specialties.
Right. So changing specialties can definitely be tricky. For me, neurosurgery to neurology, these 2 are still very related, and I had personal reasons for changing specialty. But it can be perceived as, because I'm a neurosurgeon, but I may not get neurosurgery easily, which is why I'm changing. That is the most common perception, or the questions that I was asked. Some even asked me that directly, that are you applying to neurology because you won't match in neurosurgery? So that was not the case for me. So I think first, it is really important for you to sit down with yourself, ask yourself what the reason for the change is, prepare a good answer for this question, because if you're changing, this is the most important point where your interviews are going to center on at most of the places. So maybe I didn't get the question right, but I think that's the only suggestion that I have, that you really need to know why you're switching. Whatever reason you may have to be honest, but it can't be a very personalized answer. It has to be a professional answer, and it has to be a professional reason that, you're changing. Like for me, there are many options after neurology. I can go into intervention, I can do stroke, that is still related to my current field of practice. Or I can, go into movement disorders. I can see Parkinson's and movement disorder patients in the clinic. So you have to know what you're aiming for and why you're changing, and you have to prepare an answer accordingly. And I think sometimes you have to be a little tactful in answering and handling these questions. Secondly, I think program outreach was what helped me get more interviews. I started reaching out to programs early on from July, August. As I was making my program list, I was parallelly also emailing everyone about my profile and, simple questions. I would go through their website and see if some point was not mentioned. I would just go ahead and ask them, maybe use that as a reason to reach out to them that I did not find this information. Do you accept old graduates, or this is my profile and what more I can do? I think that really helped me because they knew me. I was talking to them early on, and also connections. I did 3 months of US clinical US rotations. I was able to make some connections. I wouldn't say 3 months is a very big time, but I did make connections at the places where I did rotate. If you have more time, definitely I would say do more rotations than dedicating time to research if you're really interested in securing more interviews, because that is going to help you get more interviews than just being in one place and doing a research, having a research position. So I think that's the best way I can answer these questions.
Thank you. Thank you.
And one more point, if I can add, sorry.
Yes, of
you
course.
should reach out to all your school alumni, everyone that you know in India, all of your, say, local medical groups. Like if I have a neurosurgical society here, if I have a neurological society here, reach out to everyone. Just tell them, it doesn't hurt in reaching out to people. Someone might just know someone and things might just work out.
Thank you. Next question, I think all of you have answered in some way or form. But people are asking for an older graduate. How did you not get filtered out, and how did you land these interviews? So maybe Elsa, we'll start with you, and then we'll go. So older graduates, year of graduation could have filtered you out, but it didn't. So you, and then maybe Ritika, how did you approach it?
Yes, I think we have to be confident that as all graduated, we also have a lot of experience, and that is going to be our biggest strength. And you have to show it in a way in your RCV and during the interviews. I was told in my interviews, okay, you are the most experienced applicant that we have, and you feel good when they see that you have worked a lot, that you have a home residence. In my case, that's the way you can shine with the interviewers. It's being out graduated. It could be a bad thing, but also it's good because it shows that you have experience, not only in knowledge. You have experience how to deal with different type of patients, how to deal with their work every day. So you should show that in your interviews.
Okay. Ritika, how did you not get filtered out? This is the question.
I think, like Elsa said, in my case also, because I had a home country residency in internal medicine and I completed it in 2019. So if you calculate, so I also completed it within the last 5 years. And many programs, they actually favor the home country residency in the same specialty that we apply. Not all programs have filters. Many programs do the overall review of the application. There are, of course, some programs who reply to me that they cannot, although having a good profile, they cannot give me interviews because of my older YOG, but many programs really liked my CV because of having a prior home country residency. And since my residency completion is within the 5 years time frame, and I have a continued experience, I did not have any break in my CV. Even coming to US, I worked and I had continuous clinical and research experience. So if program see that you have a home country residency, then you have a continued clinical and research experience, and they really take it in a good good way. And I have all complimented in my interviews, I am a very hardworking person, and they really like my CV.
Yes.
Thank you. All right, let's kind of move on to the next theme that we have, and we'll keep taking questions. But for the next theme, I want to bring in Rishi from our panel, who's going to talk about planning right from step one. So we are shifting gears from older graduate to relatively recent graduates, and how others who've asked, when to join Sarthi and all that, you can join Sarthi now if you're interested in the next season's match, and Swati can send you the URLs. We are actually running some discounts till tomorrow for the match week. So for our gold, platinum, and bronze plans. So take a look at that on our website. But let's bring in Rishi now. So Rishi, if you're there, and it's hard for me to see which panel. Rishi, are you there?
Yes, I'm there, but I am unable to.
Okay, Rishi, do you want to get started?
Yep, I can start on it. So
hang on. Maybe I should. Okay, I will give you maybe. Okay, now you should be able to share your screen also. See if you can. Okay. So let's hear your experiences and tips for the students.
So hi everybody. So my name is Rishi Chaudhary. Some of I think the first and the biggest challenge which I really faced was coming from a med school where many people don't really take the USMLE path, and being completely new to it and having like a handful of seniors, I really felt the need for early guidance. Although right now I've matched into a combined MedPeds program at Metro Health in Cleveland. Going back in time, if I had to tell you guys what is something which you should do, is something, if you are from med schools which don't have many people doing USMLE, is something planning early, like having the right kind of guidance from the start. Sarthi has a lot of plans and a lot of things, even on their free Telegram group, where I have myself contacted the panelists and different people to get an idea of how to start various things, like how to submit the different forms, form 186, 183, and how to start my preparation for step 1. So you can always look into it. So it's basically like you start from the scratch to start your matching journey. So I think even Sarthi has some videos on titled as Scratch to Match, where they discuss the entire process right from the start of your med school to the end of how you proceed through your USMLE journey. So you can definitely look into that also. Secondly, I also, the second time when I felt the need where I needed some kind of guidance and motivation was when I was looking for various rotations. There was this time when I was in the US for when I was in the US, I didn't have any rotation that time. That is when I looked into various hands-on rotations available on the Sarthi platform. And I was able to get a rotation in Chicago with Dr. Coleman. And my experience was very good because it was a hands-on rotation and it was heavily based on didactics, which actually really shaped the way how you read through your residency and how you proceed and talk to any patient about any kind of disease. And I still have those practices inculcated with me right now. So you can always look into these rotations through Sarthi and see how it helps you out. These are the things which I think most of the issues which I had, like starting and how to plan out rotations. And once you're in the groove of the system, like once you're done with your step 1 and once you're getting into the momentum, then I think you are confident enough to proceed through the journey. But it's all about how you get the start, like how you have that initial push. And I think you can always look out to Sarthi for that initial push if you don't have any guidance and if you feel that you don't get the correct guidance wherever you're looking for.
Thank you, Rishi. Just by way of completion, what is your year of graduation and some other bit of introduction about you?
Right. So I graduated in 2021 and I took my step exams after internship. Like I'm done with all step 1, step 2, and step 3. I didn't take my step 3 before September because I think I was too anxious with the whole match process and I couldn't study for it. But I did take it in January and I already got my result right away, right now. Then as far as my US clinical experience is concerned, I did like almost 6 months of US clinical experience with I think with 4 weeks with USMLE Sarthi in Chicago. and one of them, and the other 8 weeks was with an inpatient observership, and the other 8 weeks were in an outpatient clinic. So this is how my USC was spread. Then I had taken up the interview plan specifically from Sarthi, because I think, yeah, the silver plan. Because I needed some guidance on how to proceed with the interviews. And I would say that even if you are a person who speaks in English regularly and you're very confident with your English, there is a certain way in which the answers are framed, and that is something which I really needed to know from the Sarthi videos. And I think whatever experience Pawan shared with us, he used to keep regular classes, and those small tricks and tips on how to get various tricky questions, like if they ask you that, do you have any other specialty in mind, have you applied to any specialty, how to phase through those questions and how to get things in your favor, those are the tricks which I really learned from those videos. Besides, I would also like to point out that the interview mentor, the doctor who interviewed me and who took my mock interview was amazing. He gave me like a very perfect feedback, which I think I remember till the end of my interview cycle. I had around 6 interviews, and I think all of them were fine, and I matched at my top choice.
Thank you. Thank you. Now let's move on. A couple of other themes, and to my panelists, if you need to leave, I understand. Feel free. Somu, Ritika, Anaga, Elsa, if you need to leave, much appreciate your time here. So the next session is importance of CV, the EDA CV, letters of recommendations, and primarily what program directors are looking for. And we'll have Fatima and Avneet, our match students, talk about this. So let's go to you, Fatima.
So hi, I'm Fatima Shakna. So I matched into internal medicine residency in St. Joe's Medical Center. So again, I had a chance to speak with one of the program directors. He was a fellowship program director. So I got to know what program directors look for in your CV. So what he told, the information which I got was he told me your experiences, the US clinical experiences should be the most recent ones, like less than a year, and your language, your grammar, it's really important. And if you had a chance, you can just ask them people to review your CV. I think I asked multiple people to review my CV and my personal statement, so that did help a lot. So grammar is an important part, and again, your CV should be concise. It should not be so small or so long. That is really important. And try to make bullet points out of the CV, and try to make their CV as a really professional one. So CV is really important. And I want to emphasize the importance of hobbies section. That is also really important. Hobbies sometimes serve as a start point for a good conversation. So CV is an important part of your medical application, and you can even if you have low scores and even if you're old graduate, you can easily cover up those points by having a good competitive CV. So get it reviewed by a personalized mentor or even Sarthi team. You can ask them to review the CV. That did help me a lot. I felt that it was one of the reasons which made me to get a few interviews, like a good count of interviews. So CV is an important thing. And again, regarding the LORs, so LORs should be a personalized LOR, and LORs from a program director or an associate program director have a great impact. So try to get good LORs and be punctual to your rotations. You can send your LORs writers to your CV as well as your personal statement, so that they can orient writing the LOR according to your personal statement. And yeah, these are the few things which help me. So good competitive LOR and a good CV can fetch you a lot of interviews. And yeah, so these are the few things. And one more thing, right? Just ask your LOR writers to upload it before the deadline. So that is also really important. Like before 20th September, your application should be perfectly ready so that you will get more interviews. And any more questions?
Thank you. Thank you. Sorry. You were saying something, Fatima?
No. I'm just asking you. Yeah.
Okay. So the next speaker is Avneet, and she has a slightly different profile. She's also going to talk about the CV, LORs, and what program directors look for. She does have a US master's, and she also wanted to give you some tips on how to maximize the use of resources that you have. So whether it's Frida, Residency Explorer, other official resources, or even the Sarthi resources. So Avneet.
Hi, everyone. I am Avneet Arora. I am a 2016 graduate. I did my master's in public health at University of California here in Berkeley. I matched into internal medicine at my top choice at a university program. So everyone here who thinks is an old graduate and can't match into a university program, please don't let that stop you from at least trying and applying. You never know what from your profile they can end up liking, and your interview can go really well and you can get ranked to match just like me. So coming back to talking about personal statements, CV, and letters of recommendation, I understand for people who come from India, personal statement is the most difficult document to create. We have never written something like this. When somebody told me, sit and write your story, I was like, I don't have a story. I saw my father doing medicine. I went into medicine. And they were like, write this. Write what is true to yourself. Write what got you into medicine. Don't start with the sick patients because the PDs are tired of reading that. People keep on talking about what happened with the patient and how it affected you. You would rather change it to why you took up this field, why you got into medicine, what happened during that rotation that changed your mind. You can just write one line about the patient, but what changed you, what changed your mind is more important in the personal statement because it is your story and not a case report. So please, 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 please keep that in mind. The second thing is people try to put on all those heavy English vocabulary words from thesaurus. Please do not do that. Try to avoid. I can give you an example. Like you can use, I'm fascinated by this field. I was intrigued towards pursuing it rather than using words like internal medicine captivated me or I'm mesmerized to pursuing this field. Something that the PDs are looking for is a simple personal statement which has a good flow and gets them interested. If you use all these heavy words, they'll have to go back and forth reading into those sentences. The flow is lost, the interest is lost, the idea is lost. They don't have that time. They're reviewing 2,000 applications. So please keep that in mind. For letters of recommendation, I did my clinical rotations as well as my research projects under the same physicians. So my letters had my research skills being highlighted as well as my clinical experiences. And that was appreciated in almost all of my interviews because they took up those projects and they talked about it and they're like, we're really impressed how this was written about you. Can you please elaborate on what you did? It was a very interesting project. We really liked what you did. Can you please discuss more? So all of these things were being talked about because my letter writers wrote that in my letters of recommendation. And that was so important for me. I specifically asked them, like, this is what I have done. I'm applying for internal medicine. I would highly appreciate if you could write me a strong letter of recommendation. And they understand that because they are program directors. They are doing this year after year. So they would not write you a generalized one if you ask them for that. But to be in that place to ask them, work under them very nicely, be polite, be professional, and the most important, just be humble. Don't act like I've come from India, I've done my residency, I'm better than everyone. Have that humility when you're working here. It's going to take you a long way in this journey. Trust me on that. For my CV, the other thing was I tried to use all appropriate active verbs. So my first draft was volunteering experiences, setting up free clinics. I got it checked from one of my Native American English speaker, Native American friend, and he was like, you can use organized, conducted. And those were much better quality of words saying the same thing and much better active verbs to be used in that context. So that really helped my CV to take it up a notch, to make the person who is reading it a little more interested rather than just simply setting up free clinics. From resources standpoint, FRIDA, Residency Explorer, everybody uses that. Everybody needs those program lists, which programs to search for, what are their cutoff for points, visa seeking, everything. What really helped me was to understand how to make the most of these resources. FRIDA, Residency Explorer, make that Excel sheet as Ritika has already spoken about. What helped me was Sarthi's interview preparation. They have webinars, be it free or be it for the Sarthi students. I always signed up. I always sat and attended it. Even if I couldn't turn on my video, my earphones were always in my ears. I was listening. They have touch points at monthly basis. They would keep up webinars of outreaching in October. They would keep up webinars of people who have less interviews. How can you reach out more for those people in November? So at every month timeline, they have those targeted webinars that are happening, which really helps you keep in touch with the journey and what is happening right now. Okay, October is the month to reach out. November is the month for people who didn't get too many interviews. Start preparing for your step 3 and start reaching out even more aggressively. So all of these things you would understand only if there were people guiding you who have done this year after year. The interview preparation, being a Sarthi student, every month there were so many interview sessions being held. I made it a point to watch all of those videos every month. Everybody knows what to say, how to say it, and how to elevate all of those sentences, highlighting your skills and what you have learned is so much more important than just being able to say. For example, if people ask me in the interview, did you have a difficult patient? Everybody has a difficult patient, but you're not supposed to talk about the patient here. You're supposed to talk about what you did. How did you handle the situation? What did you learn from the situation? And what would you be doing further on if there was something similar happening? That is what they want to know. They want to know what you have learned, what are the skills that you have gained, and what you bring to the table. So be confident, and instead of talking about patients more, talk about yourself, talk about your journey, talk about your skills and what you get to the table. That is so much more important to highlight your skills. And I believe I answered all of these questions. If there's anything else, I can talk more.
Thank you, Avneet. Yes, there will be questions, so we'll take it at the end of the session. So I know our next speaker, Karna, is here, and he wanted to talk about how do you overcome lack of research and other challenges as a recent graduate. So Karna, if you want to introduce yourself and then touch on some of these themes.
Hi. Hi, Pawan. I'm Karna, and I have matched in internal medicine at my first choice, and I'm a fresh graduate. First of all, I'd like to thank you, the Sarthi team, for helping me achieve my goal. And congratulations to all those who matched, and good luck to those who are applying next season. So obviously, as I was a fresh graduate, I didn't have the research, and I had just taken my step to an OET in the month of June. And as the application process is very costly, everyone around me was telling me to drop out this season and asking me to apply next year with a better CV, with publications in research and all. But as I was all confused, a senior of mine asked me to take Sarthi membership. But she said that it was very late because by the time I took the Sarthi membership, it was already September 14th. And she was in doubt that whether they can add much value to your CV because it's so late now. But Sarthi team was outstanding, was super quick to give me a quick review of my CV and personal statement. And I received actually my ECFMG certification on September 22nd, and I received my final LOR on September 27th as well. So, and I was able to apply for the next season. So even after the application, the lectures were, even after the application, the lectures were from the mentors, regular phone calls with Pawan and Tax from Sejal were really helpful in drawing the interviews with those particular very personalized letters of intent. And even after those interviews, I was preparing for, when I was preparing for those interviews, the lectures were so helpful to me. And luckily, the interview I received through those letter of intent, I got matched to that particular program. So I would once again thank you to the Sarthi members and everyone for making my dream come true. Thank you.
I'm quickly going to
Thank
add
you.
something, Pawan, if that's okay.
Sorry, Abhi.
I'm quickly going to add something, if that's okay.
Yeah.
So all of this that I just talked about, everything was from Sarthi's webinars, Sarthi's videos. The only thing you need to do is, as students, we need to sit down and watch them so that we are making the most use of all the resources available to us. Everything that they do here, they have been doing it year after year, and they have experience in doing it. So they know how things are supposed to be done. And the Telegram group is one place where there are so many people in the same shoes. You ask one question and there will be so many people helping you out. So at the back of my mind, you always have that peaceness. Okay, if I post a question here, be it in the middle of the night, there will be somebody answering it way more faster than me finding it, asking 10 other people. And that would come from people who have experienced it. So you can even trust those responses. So that is something I wanted to add about the Sarthi community that we have here.
Thank you, Avneet. And for those of you, if your questions are not answered today, we do go live on Instagram on a weekly basis on Friday. Just FYI, if you want to take that. So our next speaker is Sumer, and Sumer is going to talk about how to differentiate yourself. So some kind of an overview differentiation as a USP. Sumer, are you there?
Yeah, hi, I'm here, Pavan. How are you?
Good. Thank you. So all yours.
So hi, everybody, and congratulations to everybody who matched. So a little bit about me. My name is Samir. I'm a graduate of Christian Medical College from Ludhiana, and I had decent scores in step 1, and I worked harder and got a better score in my step 2. Excuse me. And then I eventually ended up getting about 26 interviews. I dual applied for neurology and internal medicine. And I just wanted to talk about a little bit about how you yourself can differentiate yourself from other candidates. So everybody's going to have low scores. So I'm sorry, everybody's going to have decent scores in United States clinical experiences too. So, and you're going to have them too. And also everybody has access to Sarthi's videos, other YouTube videos. So how would you really differentiate yourself from other people? So one of the things that really I felt that interviewers felt that stood out in my application was my ERAS CV, which was carefully made for neurology and internal medicine, and also my personal statement. So one of the programs that I interviewed at, the PD said that the personal statement was so carefully and nicely crafted that it looked like somebody with a left hand had written it, because it was just so nice. And I'm not tooting my own horn here, but it's just what he said. So everybody knows you need to have a good PS. So the next question would be, so how would you get there? And I think the easiest answer to that would be just be yourself and try to put into your personal statement why you got into medicine and how medicine excites you and how you think you would be a good candidate for their residency program. And with that, I also want to talk a little bit about interviewing. I interviewed at a lot of programs, and something that can really make you stand out is just saying hello and good morning. I was interviewing at a program and I said, good morning, Dr. So-and-so. And they're like, oh, here's something wonderful for you already. Nobody has said good morning to me all day during interviewing. So that something simple as that can make you stand out. And another thing that would help you do so is just having a professionally taken photo for your ERAS CV. So it just looks very carefully crafted and just a professional CV as well. And as far as interviewing goes, so I was also an Indian graduate, and I had never interviewed before this in my life or written an essay for my personal statement. But the good thing about these things is they can be learned over time, just like medicine. I mean, none of us knew how to be a doctor, so all of these things can be learned. And you will eventually get what you put into it, and you will eventually reap the benefits of that. So I think that's all I wanted to say, Pavan.
Well, thank you. Thank you very much, Sumer. Appreciate it. Now let's move on. And a lot of you have had questions again about changing specialties, multiple specialties, how to overcome low scores, attempts, such things, right? So before the break, we want to cover these topics before the next break. So the next speaker is Sahil, applied multiple times and in multiple specialties. So Sahil, if you're there, why don't we go to you and you can talk about multiple specialties, changing specialties, and how did you navigate?
Hey, thank you so much, Dr. Kira. I think, yes, I'm here. My name is Sahil Kapoor. I recently majored in psychiatry. I think when I started preparing for it, I was very sure that I either need psychiatry or neurology. And those two branches, I just kept going forward with them. Though my resume was heavily based in neurology, and I think you know very well that how it was, full of research, full of rotations in neurology, and you suggested me to keep going ahead. I remember before applying the second time when I was really confused that may I go for psychiatry or not, you told me one statement that you would not know if this path is right or wrong until you're completely invested in it. So I took that suggestion and I applied heavily in both of the branches. I was able to get more interviews in psychiatry than neurology, maybe because my scores are not that great, but I think I kept moving forward. I received quite a few interviews this year in psychiatry, and that helped me match. I think that was one of the things. Sarthi helped me. They pushed me a lot because they gave me deadlines that this is the time when you should give step 3. This, apart from this, you would not be able to move ahead with your previous attempts. So I think that was one of the things that pushed me ahead, that I need to give step 3 before this date. Prepared my personal statement with you guys as well. And I did heavy reach out to everybody I knew, maybe in the field of psychiatry or internal medicine, neurology, anyone, all the people from my college and from their friends, friends of friends, I reached out to everybody. And I think that helped me match.
So, Sahil, one of the questions students ask is psychiatry has certainly become very, very competitive, over the past few years. So how to navigate this competitiveness and, how do you build your profile around psychiatry?
I think first is that you have to be sure that you want to do psychiatry or not. That's one of the basic things. And then you need to do rotations. Psychiatry rotations can be anywhere, but they heavily look for if you have in-person rotations in hospital settings. That is one of the things that they asked me. So you were doing this in this hospital. What did you actually do? You are doing this. What are you actually doing? Even if I was doing research, it was neuroscience research, I also was continually doing a little bit of psychiatry research alongside, which was on ADHD. That kept me involved with the research aspect as well as the rotations. When I did not have time to do clinical rotations apart from research, I found a hospital nearby where I could do like once a week, I could go and just see the patients as the doctors were doing. So that was one of the things. And the second was my personal statement, which highlighted the aspects where I was doing, even though my rotations were in neurology, but I was equally seeing the psychiatry aspect of it as well. And I modified my resume alongside that. Okay, this is my rotation. This is the psychiatry part of it that I was doing, though I was doing neurology. But in my rotations, they asked me like, in my interviews that your resume is full of neurology. Why do you want to do psychiatry? Is there anything specific that you want to go ahead to? So I said, I want to go towards neuropsychiatry, which I can achieve either way. So which they were like, okay, we understand it. Sorry, we can't hear you.
Thank you very much, Sahil. I think I was on mute. So we'll wait for the questions, but the last set of speakers before we take a break and answer your questions is Sai, Rishabh, and Pankil, and they want to talk about how do you overcome low scores or attempts. So maybe Sai, we will start with you. Sai, are you there? Okay. Sai, I can see you, but maybe you are on mute. So Pankil, maybe we start with you.
Sure. Hi, everyone. My name is Pankil Doshi. I matched in family medicine in my third cycle. So to give you a quick overview of my profile, I'm a 2015 graduate from the Philippines. And I have a step 1 attempt and all my step scores are under 220. As I said, I matched in my third cycle. So after not matching in my second cycle, I was talking to myself that what happened? What did I do differently from my first, and what should I do new for my third? In my first cycle, I had 5 interviews. I did not match. In my second cycle, I took my step 3 and my interviews went down to 2. So I was in a bit of a shock and I was confused on what went wrong and what should I do. So after thinking it through, I decided that the first step was to join Sarthi and get something straight. I still remember the day, my first day with Sarthi, when I called Pawan sir and I asked him randomly, like, what are my chances in pathology? What are my chances in pediatrics? What are my chances in family medicine? And he smiled at me, thinking that this is one confused soul. So he asked me to take a week, think it through, and decide what specialty I want to go for. And that was one of the most crucial week for me. The answer was family medicine. And then I spoke to him again and we made a focused plan on what we want to do. His advices were like getting stronger LORs, family medicine specific LORs. And we went through a lot of details and that's what I worked on. So first thing I did was to apply for an assistant physician license in Missouri, which was, I think, a game changer in my case because every interviewer asked me about that. Second thing, doing rotations and picking rotations smartly is very important. I researched so many programs, I emailed and called everyone, and I focused on residency programs where my profile could fit compared to the current residents they had. And out of 200-300 emails, I was able to secure 3 rotations. Some were audition rotations, some were observerships, but in addition to securing good PD and assistant program director LORs, I secured those interviews as well. So in my third cycle, I had 7 interviews. And someone asked this question before that, how to not get filtered out based on just application. So one of the answer is be present when those are all soft filters. So when you do a rotation, when you're present on the field in front of them and they like you, they will bypass all the filters for you. And then the second answer is that target newer programs. Newer programs usually have less filters. They are not so fussy about that filters. So I was able to secure 7 interviews. 4 were from my rotations, 3 were brand new programs. And I matched at my number 2 choice. I technically matched at a community program, but I ranked it higher than a university program based on the reviews I got and from my rotation experience itself. And that is what it is. So let me know if you have any questions. And one more thing I want to add, sorry. So
thank you very much, Pankil.
I'll take 1 more minute, Pawan sir, real quick, for the tips. So anyone who has attempts, step 3 is mandatory for you. Always have your step 3 before September. Second is pick your rotations very smartly because you have limited time from March to September. So where you do your rotation makes a lot of difference and it will drive your journey from September to February. So that is also one important thing. And also make a focus plan. Don't get confused between IM or FM or something else because everybody likes a specific profile. So you have to apply with 4 FM LORs or 4 IM LORs and go from there. Okay, I'm open to any questions.
Thank you very much, Pankil. Thanks. And questions are coming up on chat, which we will take as well. So Rishabh is our next speaker, also talking about how to overcome low scores, attempts, lack of Rishabh. So Rishabh, are you there?
Yeah. Hello, everyone. Good morning. First of all, congratulations to everyone who matched this cycle, and the person who didn't match, keep going. This is a journey that needs your persistence, your hard work, and the people who are especially starting this journey this time. First of all, I would like to suggest, just make your mind. If you want to start this journey, you have to do it. No, don't leave it in between. If you think you can do it, you can actually do it. So in my case, I'm a low scorer, but a recent graduate. So whatever experience, whatever, due to COVID, I was not able to get much of the clinical experience, but still I managed to fetch many of LORs from my home country, and even whatever experience I could gain here after coming to US, I did that. And the things that worked for me and covering up my low score part was one of the things that played a significant role was my personal statement. I made it more of a story, more of a funny story, you can say, that why I chose medicine and why I chose family medicine. So I would suggest to anyone going for family medicine, be specific. Don't think that you can keep it as a backup option while you are pursuing or doing IM. So the program directors does not want to see such people in, and they do not offer interviews. And that is one of the point that actually says that people do not much get into family medicine. Because they are keeping it as a side profile. No program director wants you to choose if you are keeping it as a backup. Even I got many suggestions that you can apply to 10 pediatric program. You never know where you can match you or land up. But on the same time, I got some suggestions that this is really bullshit. That why would they care, and they keep you instead of keeping a person who has a pediatric specific profile. So the second thing, that was CV. Build your CV very beautifully crafted, beautifully. Every bit of it, just sit back and take time and remember everything you did throughout your medical school, after your graduation in US, in India, or in from wherever country you are. And if you are family medicine oriented, try to add volunteer experience as much as you can. Even a bit of volunteer experience, you can add it on your CV, but it may matter a lot. And like, you never know, a program director or anyone who is interviewing you, they can pick that particular point from your profile. So coming back to my personal statement, the program where I matched, she gave me a compliment that, like, she started my interview that this is the most hilarious personal statement I read till date. So everything in your profile matters a lot. And how much, no matter how much you have opportunities, gain clinical experience as much as you can in US, that also matters a lot. Don't think that I should not go to this place, I should not go to that place. Pick obviously I had a profile, I had a I have to make that profile in an era where there were limited options. Now the options are open. And always prefer a university rotation if you can get it, because you can then easily get an interview from them. That's what I was guided, but I could not experience that much because most of my rotations were from clinics even. But yeah, you can always get this clinical experience, and it is always helpful. And the last thing I would like to mention here is if you don't have much of research or publications, just there are many Facebook groups, and even USMLE Sarthi is there, everyone is there. You can just reach out to people, and whatever resource or whatever point you can get, and you can use it, just go for it. Everything here is worth and this journey is worth a wait. And once you will be here as a panelist, you will really feel what we are feeling right now. And uncertainty is part of this journey. So in uncertainty, never leave this journey. You are made for this journey, and you will do it. Thank you.
Very, very motivating, Rishabh. I appreciate. I hope audience gets a lot of motivation from your journey specifically. Okay, so let's take a break from the themes. I want to cover some of the questions that are coming up. So first question, I think Swati for you or Anaga for you. If I'm getting an opportunity for home country residency, should I do that first and then go for USMLE, or is it directly going for USMLE? Since I see both of you are still there, if you're there, otherwise I can take it up. Anaga?
Yeah, I think if you're sure about going ahead with USMLE, I don't think home country residency is going to give you that advantage. You should just straight away prepare for your steps and not delay starting the journey, because your YOG will continue to grow older. So unless you're already in a residency program, then that's a different question. But home country residency will not have an added advantage or help you get more interviews. In fact, it might just deter you. So just go ahead with your USMLE journey.
Okay, thank you. Okay, let's go for some other questions. So we've already answered, but low scores, how do I work with that? So Rishabh, maybe you can answer.
Yes, sure. So as I already mentioned, you can shadow your score profile with your USCE and with your personal statement and all other elements that you can add in your profile. So in my case, I was never asked about, talked in any interview about my scores. Never. Like I got, this is my first cycle, and then I matched in first cycle, but I got 5 interviews, and in any, no, there was no mention of this scores in any of the interview.
Thank you. Sahil, if you are there, there's one question for you. How many LORs, publications, rotations did you have?
I had 4 LORs each for neurology and psychiatry. And I had about 1.5 years worth of rotations and about 6 years of research, I would say.
Okay. Well, so your profile is very, very impressive when it comes to research. So there's one question that I think I can take. How can we create, or where can we find guidelines with all steps in the process? So obviously we do all free webinars, but in our classes, we walk you step by step on some of these dates and timelines and everything. Okay. Format of the CV. So IRA's CV has a specific format. You cannot change that format. And, so that's the format all our students are talking about. Okay, let me see if there are other questions for our panelists. And of course, our panelists, if you see any questions that I've missed, feel free to answer it as well. I'm just scrolling through some of these questions as we are in the break. So how to get into diagnostic radiology? We've had students match into diagnostic radiology. I don't think they are on this panel today. Okay, question for maybe one of you can take it. I get it all the time. Maybe Avneet, you can take it. Do we need to have a proof of this volunteer experience? And I think this is a good question. We need to understand what volunteering is, and it's not about getting just the paper in hand. So Avneet, do you want to get started? Or
Yes, I was just typing out that answer to the same question. So volunteer experiences are somewhere where you are not employed, but you want to contribute towards the society with the skills and the education that you bring. So for us as medical students, it's the most common thing is free clinics, mobile clinics, vaccination centers, or sometimes even homeless shelters. Some hospitals even have set up camps where every month they go to some rural area where they give their free healthcare service, and you can go and join there and just sign up as a medical student. So all of those are volunteer experiences. You can do that once a month, you can do that once a week, how much ever time you can contribute and give, apart from doing your rotations and research, whatever it is. I was working as a during my master's in public health, I was tutoring bachelor students. I signed up for the Dream tutoring office, and I used to teach them with the same coursework that I had, helping them with their assignments, the material for their tests and submissions. So I wrote about that as well, because that was something I did by myself. I was not employed by them. I was not paid by them. And it was something that was on my availability. If I have 2 hours on a Friday evening, I would just go and help the students that are sitting there. So nobody is asking you for a proof, but they would definitely ask you to talk about those experiences. If you have not done that, they are doing these interviews since a long time. They know how to catch lies. I would highly recommend not to do that. If you don't have a volunteer experiences, you still have time till September. There are so many free clinics that keep on happening locally every week. You can join that, go help the community, and have something to write on your paper, rather than just writing something just because they won't ask you for a proof. They will definitely ask you to elaborate on the experience and what you learned. So if it's a genuine experience, you would be able to talk about it in much more detail, and it comes through your face and your expressions as well.
Thank you, Avni. Ritika, maybe question for you. Do interviews have a specific format?
Actually, there are many common questions in all interview sessions, and Sarthi has a very good interview question set. If you will join, then they will give that set to you. And Pavan sir has short interview classes, and he took only like 2 to 3 questions in each session, and they are very helpful. Basically, Pavan sir like guides you like how to answer a question. So there will always be some common questions that will be asked to you in all interviews, but there will be always some new questions that you have never heard. But if you practice good enough with your friends and you practice with Sarthi, then you will be more confident to answer even those new questions. And even if you Google, then there are many interview questions all through the Facebook platforms and Google platforms, and you will get questions from there also.
Thank you very much, Ritika. All right, let's move on to our next theme, which is many of you will want or are looking for full-time research. So how to look for full-time research, importance of full-time research, how to maximize some of those things. So the speaker here we have is Adil, and Adil, maybe you can start, and then the next speaker was Hina, if she is around, but Adil, probably you can get started. Hello, Adil, are you there?
I'm sorry, I was on mute.
Okay.
Hello, everyone. Thank you for arranging this session, this webinar, Pawan sir. My name is Adil Mohammed. I'm an international medical graduate from India. I matched into internal medicine program, categorical track in Michigan this year. And I'm very fortunate enough to have been taking Sarthi's help. Thank you, Sarthi, as well. And congratulations to other panelists here who have matched this year. So now the theme, what I'm going to talk about is how to find research in reputed organizations in US. So firstly, it was 2019 when I was starting my journey and there was no research on my profile. So I reached out to many professors in reputed organizations. So no one was able to help me. So then I understood that the first thing is we have to help ourselves in order and then others will try to help us. So I reached out to many doctors in my home country and many I was interested in cardiology. So I approached many cardiologists and they gave me some chance to work with them. In some of the papers, we did work until 2 years. And then we published around three to four papers, three observational studies and one case report. It was very helpful for me. And then I reached out to many professors in highly reputed organizations, so highly reputed institutions. And then I said that I've been working on these things until now, and I would want to collaborate with you, and I would want to work, and these are my skills. I've listed out all the skills in the email, and then I was reaching out to them. And in this process, I've made many mistakes. I've learned from my mistakes. So the main mistake was I was emailing many doctors throughout the United States, but I was not getting replies. The one thing I got from one of the Sarthi panelists was, in my email, this mistake, I was also doing this mistake, and I see many of my peers doing this mistake as well. So we only say that we need the position and we are interested in this skill, in this kind of research. We are interested in cardiac arrest, we are interested in atrial fibrillation, but we do not say, we do not appreciate their work as well. We do not state what they're doing in that field. So that was very helpful for me. Many Sarthi panelists told me to include that as well in our email. So when we are emailing doctors, we should also search about them on PubMed, search about them on their specific institutions, about them on Google Scholar, and also cite their articles and read their articles and understand what they're doing, understand how much they're publishing each year. So that will also be helpful for us in the long run when we are doing research with them on in the organization. So when I included that part in my email, when I read those papers, when I appreciated what they were doing, when I said that I can come to your institution and then I can help in those lines, on those similar lines, and make your work more easier. And that was the time I was given an opportunity to interview with the research faculty there, and I then got this position. So I would highly suggest all the applicants to do help yourselves first. If you don't have any research on your profile, try to get that research. You can find that anytime. Just reach out to people and then it'll be useful. Thank you.
So, Adil, thank you very much. This was very, very interesting and insightful. Now, the related question is, when you are in full-time research, before that, some of you or you specifically did some rotations, because with full-time research, it gets difficult. So how did you leverage those rotations to improve your profile?
So yeah, when I was trying to reach out to people, I did not have any research. I did not have any US clinical experience as well. So first thing, now it comes down to priority. The first thing for you in USMLE process, in USMLE journey, is US clinical experience. I thought first I would do that, gain some clinical experience, and then go on and do some research experiences as well. So in terms of finding out USC, it was very difficult for me as I was from India. So I Googled, I searched, and then I found that in 2020, I think it was in 2020, late in 2020, I found out that Sarthi is giving out, is helping students with gaining some rotations. So I signed up for that. I did like 10 weeks of rotations in New York, with one with an internal medicine doctor and the second one with a cardiologist. They helped me a lot over there. In the internal medicine clinic, they taught me how to input notes in the EMR. That was my first time in US. And you all guys know that we from India or any other country where we less oftenly use EMR. So it was very helpful for me. They taught me doing that. And in the cardiologist clinic, he actually taught me how to read the EKGs, different EKGs, and he also taught me the basics of 2D echo as well. And when I thought of gaining more rotations, I reached out to my school alumni from my home country. So when I reached out to them, they were in different states. The only question they asked me was, do you have any prior experience? Do you have any prior US clinical experience? So then I told them that because of my rotations in New York and New Jersey of 10 weeks in like two different specialties, I told them I was doing this work, and they really appreciated what I did, and they asked me, how did you get those positions? I said, I did through some of the organizations named Sarthi, and they were really happy that I was at least trying to help myself without anyone trying to help me. I was trying to help myself. I gained those things. And then when I said that I had that experience, I was talented enough, I was skilled enough to write those notes in the EMR. They allowed me to work with them for like 2-3 months. I also had like 7 months of clinical experience by the time I was applying for residency, and that is how I used Sarthi's rotations to help me get more rotations. Thank you.
Thank you very much, Adil. Thanks. Okay, let's go for our next speaker, Hina, if you are there, and then we'll probably take some questions. So welcome, Hina, all yours.
Thank you, Pawan. Thank you for hosting this webinar. My name is Hina Asnani, and I matched in internal medicine in my first cycle. I would like to talk about how to get a research position here in the US. I think emails are the key, as Adil mentioned that the emails should be personalized and not generalized. I think that is very important. He mentioned beautifully about his journey, and I think everyone should keep in mind. Apart from that, this is the time where students really leave their research positions, the students who have matched. So I think getting into Facebook groups and WhatsApp groups and talking to those people who are posting that they are leaving the position is also something that you can do. Apart from that, I think research is very important for your residency as well as fellowship application, because research is a vast area, and learning how to write discussion introduction is something that I call as an art, and it is very difficult to actually get the hang of it. And I would rather suggest you do it before you jump into residency, because let's face it, we do not get enough time during our residency. And I think if you want to get into a competitive fellowship, I think research is a very important part of your application. And even for your residency application, I would say, I think research is something that people really look for in your CV. Apart from that, I would really like to talk about what you should do in your rotation while you're rotating in a hospital. I think getting into a hospital which has a residency program is the key first. The first thing that you have to do is you have to be punctual and you have to be proactive. You can ask your residents and your attendings as to if you can present cases or you can present a PPT presentation, and that's how they'll know that you are actually interested and you are proactive in your rotation and in your time there. I think the one other thing that I would like to highlight is for the students to attend noon conferences and morning reports. That also shows that you are very interested as a person and you want to learn and you're also interested in their program. I think asking for feedback from your attendings and your residents is also a very important key of your rotation. That's how they'll know that you are interested in making yourself a better student day by day. I think that's about it. I am open to any questions.
So thank you, Hina. We will take questions. Let me just go to our speaker, Sai, and I know she wanted to talk about also, the low scores and attempts and such things, how to overcome some of those. So Sai, all yours. You are on mute, Sai. I think you're on mute.
Yes. Hi, everyone. Can you hear me now?
Yes.
All right. First of all, congratulations to everyone who matched. My name is Saishri and I'm a graduate. I'm from India. I graduated in 2017. First of all, I want to talk a little bit briefly about my profile before I go into my challenges. So I graduated in 2017. I started all the USMLE journey after my graduation. I say this because I see a lot of people asking questions about finding rotations after graduation. yes, it is challenging compared to people they have who look for them before graduation, because there are a lot of universities and programs who offer electives and stuff. But yeah, it is challenging. But yeah, there are a lot of people who offer rotations. There are a lot of agencies. Even Sarthi has wonderful rotations. I did a couple of rotations with Sarthi as well. So it is challenging, but yeah, you can find it. And I took all the USMLE steps and everything after graduation, and I got low step 1 score. I took it when there was actual score. I applied last year, but then I did not match. I got 0 interviews. And this year I got 4 interviews and I matched into family medicine. So 4 is a very like 50-50 percentage chances of matching kind of situation. I know a lot of people with good scores have obviously more interviews. So the key to navigate this process, having low step 1 or step 2 score, is to obviously improve, get better scores in the next step. We all know that we hear people saying that always get better scores in the next steps, and then take step 3. I say this because first of all, it's important to understand why programs don't prefer taking people with low scores, right? So why? Because they are worried that we have trouble adjusting to the residency program or have low board passing rates and stuff like that. So it's important for you to take step 3, so that the programs know that you're done with all the steps, and it shows it clearly understood that you can handle the residency, and you can also, they don't have to worry about passing rate, boards and stuff like that. So that's the most important thing. And the second thing is to also show to the programs that you're very clinically proficient. Get lots and lots of clinical experience, get personalized LORs from your mentors. I cannot emphasize enough on this. I asked all my mentors wherever I did my rotations to literally, I asked them to write the LORs themselves, because there's always a difference. I know a lot of them don't have time. They are very busy, but still I was behind them to get my LORs written by them, and also got personalized LORs, which is very important so that they can highlight your clinical skills and highlight your personal strengths and strengths, so that the program director knows that you're really very clinically very good and you don't have any trouble navigating through the residency process. And the other thing, also having a varied profile is also important, like having a diversified experience, inpatient, outpatient, research, volunteering. Since I applied to family medicine, for family medicine is very big on volunteering and community outreach and things like that. So I made sure I had those in my profile. I literally went to a place where there is no mobile signal. There's nothing like a proper rural place in the US, which I've seen for the first time. I went there, I did the rotation, I got the LORs from the physicians over there. So yeah, so basically it's getting personalized LOR and having a varied CV, and strengthening your CV is very important. And also the program outreach. It's very difficult to get interviews because it's very easy to get filtered out with low scores, which I have experienced before. So the program outreach specifically, Sarthi helped me so much with regards to that. Before I didn't know that we can even email the programs and reach out to them. This thing I knew only after I met Sarthi and joined the Sarthi group. So I started emailing the program exactly from June. Exactly from June, I applied for around like 200 programs. And it's also important to apply to more number of programs with low scores, especially, and also email every program. No matter what, send 200 emails every 2 weeks, every 3 weeks, doesn't matter. I did all that. Yes, some people reject you upfront, which is fine. At least you know that you don't have to follow up with them and your numbers go down, which is fine. But still, I emailed every single program from June up until January without stopping. And that's how I got 4 interviews. And also the interview performance really matters, because since you don't have a lot of interviews, obviously when you have 10 interviews and 15 interviews, your probability increases. We all know that. So with 4 interviews, the interview performance really, really matters. And when they ask you questions about how did you deal with low step 1 score, or how, like, why did you get the low scores? One of the interviewers even asked me, why did you get a low score? Because you have very great score in step 2. So navigating through those questions it's a bit tricky, and you have to sound, you do not, it's very important for you to sound very neutral and very in a way that you highlight your strengths versus your weaknesses. So the interview skills is something Sarthi really helped. I joined every meeting. I know I was not actively participating, but still I listened to all the answers which people were talking. I listened to all the discussions. I made notes. I made my personalized answers. I sent emails after the interviews. I sent to every single person, the residents, the chief residents, the faculty who had interviewed me. I made sure they remember me. I made sure they know me personally, even after the interview. So that really, really helped. And the other biggest thing I wanted to mention was it is very important to be practical. Before I really applied, I was focusing on internal medicine, but it's important to be practical at some point. I know we all have our own interests, but I say this because it is important to choose the right specialty based upon your profile. Based upon your visa status, or based upon your low score, or based upon your gaps, or whatever you have. It's important to be practical and choose the right specialty and build your CV based upon that specialty for you to really increase your chances of matching. Sarthi really helped me to pick my specialty, and I was struggling between IM and FM. And then I think Pawan, I really can't forget that, because he just told me on day one, FM is your best bet. And since then I started building my profile. I did FM specific rotations. I did a bunch of volunteering, and also the biggest thing is I matched in UMass, which is a big surprise to me. Ending up an interview with UMass is a big thing in the first place. And then I matched at my top choice program. And I also saw a bunch of people asking questions who are moms. Yes, I'm a mom too. I did my entire journey with a kid. So they were asking about some gaps. Yes, I do have gaps. I have like a year and a half of gap. I was doing nothing, just at home studying for steps. Yes, it is okay to have gaps. Honestly, nobody really asked about me, about my gaps in my interviews. But then even though whenever I mentioned them that I have a kid, they were very happy. They just received it in like a very positive note. Nobody asked me, oh, why did you have this gap? What were you doing in this gap? But even if they ask, I think it's important for you to be confident and own up to it. It is okay if you give some time to your family. It is okay, because a lot of people are struggling. They don't have time for their families. Just be confident. Just be like, yes, it's important. I had to give that time for myself or my family. But then I'm really focused on this journey now, and I started back, and then I'm here now, right? So just own up to it. Be confident. All the moms out there, it's okay to have gaps here and there. I had gaps too. So yeah, that is all I have from my end.
Can I add one thing here?
Sure.
Yes, of course.
Yeah, so I have a live example of outreach.
Yes, go ahead.
Benefit of outreach. So I got a rejection from a program, but I mailed them like every week. I used to email all the programs I applied to, and after 2 weeks, I got interview from the same program.
Wow, I think I have a similar
Very
example
impressive.
too. I started emailing a program from June, every like monthly once, I guess. The PD directly responded to me. And then she was constantly in touch with me, and I got an interview from there. I interviewed there in person as well. So I think the outreach is a very, very, very big role, especially with people with gaps or old grads or low scores, whoever you think that your application gets filtered out. I think that's the key.
Well, Sai, thank you. You are a very graphic example of how to make the match work with low interviews and all the challenges as a mom, as with gaps. So hopefully people take inspiration from your journey. Thank you. So we will move on, and then we'll take questions. The other the other theme or the session, we will go back to recent graduates. So here we have Shaheen, Isha, Prabnoor, and Juma Rashid. They are all recent graduates. They want to share some more challenges for recent graduates and how to navigate the match. So maybe Shaheen, we start with you.
Yeah, sure. Hi, Pawan. Can you all hear me?
Yeah, go ahead. All yours.
Yeah. So hi, everyone. First of all, congratulations on matching to your program of choice. And it's a long journey, and a lot of other things are waiting for us. So I'm Shaheen. I'm from Kolkata, India. I graduated in 2020. And I recently matched to St. Joseph's Chicago in internal medicine. So I would like to share a few things that I have experienced as a recent graduate. So we have certain challenges when we apply in terms of the CV building and all. So first and foremost thing that I would like to say is having a particular timeline or a plan in mind. Unless you're a medical student in a college where you have a very strong alumni network, where you have a strong guidance, you need to start early on if you want to apply as a recent graduate just after graduation. So you need to take your steps early. You need to make a solid plan for USCEs. So at the same time, when you apply after finishing your med school, you will see in terms of CV, you might be lacking a few things. For example, in my case, I did not have enough research experience because I was not exposed to, and at the same time, maybe I did not outreach to research mentors who could guide me in that accordingly. So you need to be proactive, and at the same time, you need to seek out your mentors who can guide you through this process. In terms of CV building, you will see that as a recent graduate, you might feel what to write, what other things to mention. You may feel, okay, my CV might look shorter. Then you'll think about those volunteering experience. Somebody asks the volunteer experience, how much is enough, or how impactful or how genuine it should be. Well, coming from a med school in India where volunteering is not a big thing, it completely depends on us, how proactive we are. So you once you decide early on in your medical school that you are going to pursue this journey, I think attending the blood donation camps or sometimes going to some health checkup camps. So by doing that, you can kind of improve your CV. At the same time, networking with different people, with experience that you gain after graduation, you become more mature. You know how to reach out to people who can help you, and effectively you can use those connections when you're applying for residency. As a recent graduate, you may not have you may not be familiar with all this process, and that can come up as a challenge. But as I've said, when you reach out to people and you build a small community of your friends or mentors, I think you can get what you want. Thank you. If there's any other question, I'll be happy to.
Thank you, Shaheen. And I think we'll get to questions in a bit, but you can look at the chat. Our next speaker is Prabnoor. Prabnoor, are you there? Thank you. Thank you, Prabnoor. All yours.
Yes. Hi, everybody. Good morning, good afternoon, good evening, wherever you are in the part of the world. My name is Prabnoor. I am a 2020 graduate, and this was my first cycle, and I applied into family medicine, and I'm really happy that I matched into it because this has been always my dream to match into family medicine. And I think that the thing with me was that because I knew that I really wanted this branch, I always catered my profile according to this branch. And I purchased the platinum membership and the platinum membership of the Sarthi team. And I think that was the best decision of my life because I got to have one-on-one mentorship. And because the type of person that I am, I have a lot of doubts and a lot of questions, a lot of things I need to address to. And I always wanted to have somebody I can talk to, I can question at any time of the day. So I had a personalized mentor who guided me throughout this journey. And I remember at one point, I had this doubt of whether I want IM or FM, because a lot of people guided me into the thing that the IM branch has a lot of openings, like a lot of positions, and FM does not have that many positions, and FM prefers more of the American medical graduates. So, I mean, a lot of things were going on in my mind where I think the Sarthi team and the Sarthi mentorship, I think, helped me a lot in that matter. And I really thank Pawan and everybody on the team on the Telegram channels, on the one-on-one mentorship, Dr. Steve Shah, and everybody else who helped me throughout this journey. And I think for me, because I knew I wanted FM, I always knew how I wanted my profile to look. I wanted my profile to, I knew the program directors would want to look at my profile and say, okay, what is there that we can look for in this person? And they should know that I am their candidate. So for that, because I was a recent graduate, I gathered a lot of experience. I did the telerotation in the times I could not go to US because there was a travel bubble, as we all know. So to cover that, I did a telerotation. I also did inpatient rotations. I did outpatient as well. I did a lot of rotations through the Sarthi as well. And I think all these experiences, the directors and the faculty members, they did see all of that, and they addressed this during my interviews. One of the faculty member, they told me that I was the most experienced the interviewee they had on the day that they were interviewed. So I think the extensive experience I had really helped me. And I also think that I did a fellowship in palliative medicine. So I knew that I wanted to do FM. So I knew that I wanted my profile to be solidified in the FM. So I did that also. And I think that was like a very strong point in my profile that they picked on. And I always had to talk about what was that, how I did it, how it affected me. So I think that was really a strengthening point in my profile that the program directors and everybody picked up. And I think I am just beyond ecstatic at this point. And both me and my fiance, we applied this match, and Rishabh, he's my fiance. We did not go for couples match because that was our personal choice. And also we talked about this to our mentors. They told us the pros and cons and everything. We should do it or we should not do it. So, but then we ended up applying in the same programs, and we matched in the same program as well without a couples match. So I think in FM, and that was something that was really, really amazing for me. And I was really above the clouds and everything, and I was dancing. So I just want to tell everybody that recent graduate is a big star in your profile. Don't think that that will be something that will take you down. No, it's not going to. You just have to cater your profile in a way that the other things will augment that thing. So that's the only thing that you have to do. Start building up your mind, what you want to do. And if you have one or two specialties that you think that is it that or is it this, I would recommend taking up the Sarthi mentorship and talking to the mentors, because that really helps. So talking to Pawan, that really helps, because they've done this for so many years. They know when they see a child, like, what does he want? Like, what is he capable of doing? And what does the profile look like? So if you have any doubts, if you have anything, I would recommend you taking up the Sarthi mentorship and then talking out to them, and then start building your profile from day one. And start structuring out your profile, like how everybody knows like how many US clinical experiences you can have. If you cannot go into the States, then start doing some telerotations. Sarthi has a lot of telerotations as well available. So I mean, do something or the other. Don't leave out a gap, because that is what a lot of interviewers, they appreciated, that I don't have a gap and I've done so many things. I've been into this and that and that and this. So obviously volunteering, if you're into family medicine, from my personal experience, I would say volunteering, start doing something that will show your interest in family medicine. And then a lot of family medicine experiences. So I think being a recent graduate, don't fear that it's going to go into a negative direction. It's a very, very big plus. Just start choosing things that are going to augment your profile, and you're going to be all good. And I hope you sit on this side of the table next year, whoever is listening. So all the best, everybody.
Thank you very much, Prabhnur, and congratulations. I mean, you guys pulled off something which is not easy, couples match without going into couples match and matching in the same program. Yeah. is very, very impressive. Do you also want to spend a couple of minutes on the importance of positive attitude? I know you both of you have had a very positive and motivating attitude, but a bit more on why this actually works. Why is this so infectious, a positive mindset?
I think, Pavan, we started our journey in 2018. So it's been like 5 years we've been into this journey, and it's not going to be a stable journey. So it's going to have its ups and downs, both professionally, personally. You're going to be surrounded by a lot of people saying that you should quit and start doing this, or you should not do this. So you're going to have a lot of seeds being planted in your mind. And for for me, the only thing that mattered for me was both me and him. We wanted to do this, and that's it. And we wanted to do FM, and that's it. So you're going to have a lot of troubles. You're going to have financial troubles. You're going to have parental troubles, siblings, societal, everything. But always try and have something good at the end of the day. Try and think that, okay, why I started this journey in the first place? What was the thing that really pulled me towards this journey? And always go back before you go to sleep. Always think about that reason over and over again. It's not going to be easy, but I know, because I sat on the other side of the table and I used to listen all these live sessions and everybody talking, and I always used to dream, like, when will I sit on that side of the table and be at ease? But it's not going to be easy. But be persistent if you really want to be here, and you're going to get here. And what really helped me was positive mindset. That was what I was talking about, because you can't be in this journey with a negative attitude that, okay, I can't do this, I won't do it. You're going to pull your morale down. So read good books, listen to good podcasts, surround yourself with good people, talk to good people, talk to your seniors who matched, and set your goals. I think that really helps you, that really builds you, and that really pulls you towards your goal. And I think that's about it. And if anybody else wants to talk about positivity, I can go on, but I'm going to stop here. So thank you everybody for watching, and I'm open for any questions if you have. Thank you, Pavan.
Thank you very much, Prabnur. Okay, our next speaker is Juma Rashid, again a recent graduate, and he wanted to share his experience and tips with you. So Juma, welcome. If you want to introduce and then share your experience.
Hello, hi Pavan, how are you?
Very good, thank you. Thank you for joining. Appreciate your time.
For inviting me to speak on this webinar. I'm so glad to be on this side of the table. And a bit about myself. I am Juma Rashid. I graduated from in India, and I matched in my first cycle in IM categorical position in Michigan. And a couple of pointers that I would love to give you. A couple of things I learned during this experience was, as a recent graduate, was always plan ahead, right? It's always important that you have a perfect plan for this journey. Like Prabnu mentioned, this is a very tedious journey. You're going to have your ups and downs. A lot of people are going to bring you down, saying that, why spend a lot of money? Why go for this journey when there's a lot of stress involved? But it's all worth it. And as long as you have a perfect plan, you're going to get what you want. And as a recent graduate, you have to plan ahead from your medical school. You need to know when you're giving your step 1. You need to know when you're giving your step 2. You need to know when you're getting ECFMD certified, and make sure you have the plan in mind. And also, you should also plan your specialty. Focus on one specialty so that you can cater your CV and your personal statement to that specialty. So planning is very important. Second thing is always networking. If you have alumnus in your college who have matched into US residency programs, make sure you reach out to them. That's very important. I did not have many seniors of mine who matched into residency programs. So that's when Sarthi helped me. So once I joined the program, we have a very close-knit community of Sarthians. So we have panelists, we have other students who are also applying for residencies. So it was really easy for me to ask doubts and get them answered. And it was an amazing experience, because I was clueless about a lot of things, because this was my first cycle. I did not have the proper guidance. So the Sarthi community really helped me to navigate through that process. So that's another thing. And next thing is that, obviously, always have realistic expectations, right? So my profile was pretty average. I had average scores. I did not have much research experience. So I knew the colleges or the programs that I would match into. I knew what sort of program that I'm looking for. So more than program outreach, I think what what's important is program research. So research about the programs. So I remember doing this all the time. So I used to go through each and every program websites and see the current residents in the programs. And if I see a lot of Indian residents, if I see a lot of residents who have matched from Indian colleges, I would straight up send cold emails to them. And I have secured a couple of interviews like that just by sending cold emails to those programs where my profile would comfortably fit in. So it's very important that you research the programs and then do the program outreach so you have high chances of matching into those programs, right? So by realistic expectations, I mean that if you have no research, but if you have a lot of USC, you're looking at a lot of good community programs that you might fit in. So always reach out to a lot of community programs. If you have a lot of research, if you have a lot of USC, if you have like amazing scores, you can be a good candidate for university programs. So always reach out to university programs. So the idea is to choose the program and that you perfectly fit in. So like I said, it's going to be a really hard journey. I mean, I had a lot of ups and downs. I went through a lot of, it was an emotional roller coaster, but trust me, it's all worth it. I am very ecstatic. I'm happy that I'm staying on this side of the table, and I cannot thank the Sarthi team enough. I cannot thank Pawan enough. Pawan is like a robot. I mean, he's always there to answer all of our questions at any time of the day. And the Sarthi team has helped me to get my dream residency. And I am open for questions. Let me know if you need something.
Thank you very much, Juma. Appreciate your tips and experiences. Let's go on. Our next speaker is Prasanna. He's going to talk about why perseverance matters, and how he overcame all the challenges. So Prasanna, are you there?
Hi, Pawan. Yeah, I'm here. Thank you for this opportunity and inviting me. I'm sure that you're able to hear me properly, and the rest of you. So a very good morning, good afternoon, or good evening, wherever you are. So, and as my friend Juma spoke before me, I'm definitely glad to be on this side of the table, and I'm really excited today to share with aspirants who are going to apply for the Match 2024 and in the future. So I would be talking on the topic why perseverance matters. So myself, like I have a personal example, like I applied for Match 2022 and I was unable to match, but definitely this year I would never have dreamed of a program like this where I definitely ended up. So that is a really good thing. So to talk about perseverance, the most important thing is like match is definitely a long-term investment, and so how do you go about it is like, as Juma mentioned, like you start earlier. So a lot of students, if you can access like Facebook or Instagram or Twitter, they definitely know what to do. But Sarthi helps you to plan like very much ahead. So when I spoke to Pawan in June, like after my match results, and then he was like able to guide me like where I was lagged behind and how I should keep going about it. And definitely, as Juma told, networking is like the single most important factor, in my opinion, in match. So, so to talk about the perseverance part of the match, I would say like there will be a lot of people who would be like discouraging, like it can be from your seniors or it can be from your co-applicants. Like, so it is like you would be comparing yourself, like I don't have so fancy scores, or I don't have a lot of rotations, or I don't have a lot of research experience. So so to put it down to that, like I would say each program is looking out for a unique applicant, and then the right program will definitely select you. So as Juma said, like also be realistic in your expectations, and start your program research, and also start doing your work today, so that like I probably would suggest like by at least end of August you have communicated with the programs that you want to match into, and you have already did your groundwork. So September is for like applying to those programs and getting your part ready for the match. So to talk about that, like the whole season, last time I had just one interview, and so in 2023 when I applied for the match in September 2022, like on the very first day of the application review, I got my first interview. So that is something like I would like to talk about here, because it is just because like I wanted to match. I kept on working towards what I had to do, and like so the last season gave me a lot of experience, like the things that I needed to work on, and definitely I was able to tick all the boxes. And I think that kind of helps all of you as match applicants. Like a lot of people, I definitely wish everybody matches with their first cycle and comes to this side of the table. But yeah, there will be quite a few people who don't match, but that doesn't define you. So you always got to keep working and always have a backup plan. So when I didn't match last year, I wanted to finish my step 3 and do a couple of more rotations and research. So when I did all that and joined Sarthi, they were really able to help me in finding the right programs. And yeah, definitely that is like I want to talk about. That is all about perseverance, which I had to speak about. So to finish my talk, I just wanted to work on 3 things. Always have a positive attitude. Anybody with any scores, any year of graduation, or any number of attempts, if they had worked really hard and be dedicated to their specialty, definitely everybody deserves to be matching, and everybody will match. So there is no nothing like, so you got these scores so you won't match. There is nothing like that. Everybody can work on their profiles and definitely match. And that is all I'm going to talk about perseverance today. And if any questions, I'm definitely here to help you with.
Thank you very much, Prasanna. Thanks a lot, and congratulations on your match. I know you worked very hard.
Yes, Pawan, thank you so much.
All right, thank you. Let's go on to our next speaker, who has had an unconventional journey, to say the least. So Nikhil is our next speaker. So Nikhil, given your unconventional journey, why don't you introduce yourself and then talk about how you went about the match?
Sure. Thank you, Pawan, for the introduction. Surely it's been a really unconventional journey for me. So just a background, I am Nikhil from Hyderabad, from India, and my year of graduation is 2010. I matched this cycle in psychiatry at my first choice program. And so just a short background for me. I graduated in 2010. I do have a home country residency in psychiatry because I did not plan for US at that point of time. I started planning for USMLE steps and also pursuing residency in 2016 after my psychiatry residency. So just a brief view of what my interview cycles were like. First year, 2019, I had no interviews. And second cycle, 2020, I had 1 interview. 2021, I had 1 interview again. And for the 2022 year, I had 6 interviews, including 1 pre-match. And for this year, I had 7 interviews. So just to speak about, what changed. So for the first 2 cycles, I was applying, of course. So what didn't work for me? My old year of graduation. So I'm 2010. That's kind of like, by the time I was applying, I was already year of graduation, maybe 9 years. So I was already kind of like on a back foot at that point of time. And then my scores were not that great. I mean, even by psychiatry standards, I don't think my scores were great. I do have an attempt on CS, and I didn't have step 3 right in time by then. So none of the factors were working out for me then. So how did I change from 2020 with just 1 interview, and 2021 just 1 interview, and 2022 I had 6? What changed was, what worked for me was, I had home country residency, psychiatry residency. So that's where I was able to take an unconventional route and come here for an accredited fellowship, for a geriatric psychiatry fellowship, because there were fellowship positions vacant. And I came to know that if the positions are vacant, the program director has the option to take an exceptional candidate, provided, they have a home country residency and they're able to meet an exceptional criteria. This is in the ACGME regulation. So it's completely valid. It's not kind of like you're taking a, unknown route. It's a valid exception. So you can still do that. So I took that fellowship route, and I came in here to do an accredited fellowship. I think it worked out for me because I didn't have to. I was an attending at that point of time. From 2016 to 2019, I was an attending. So I didn't have to probably leave my job or have to take some time off to come and do rotations. So when I decided to do take the geriatric psychiatry fellowship route in 2021, it was a tough call. I left my job back in India. I kind of like
went all in, and that's something I would say is the hardest thing to do, because it's a leap of faith that you need to take at that point of time. So I did the geriatric psychiatry fellowship, and it's an accredited one, so it does count as, of course, a US clinical experience, and I was able to get letter of recommendations from that. And of course, since it's being paid, so it kind of worked out well for me as well, because I was able to sustain myself and also apply in that cycle. Fast forward, in that cycle, I had 6 interviews, including 1 pre-match, but I didn't match. I was honestly thinking that probably it was that year to match, and I would probably get in because I had this US clinical experience. And by the time I applied, it was roughly 4 months of USC into my fellowship. So 4 months would still count. That's what I thought. And also, because I had letter of recommendations at that point of time, I had 3 US LORs and 1 Indian LOR, but I didn't match. The reason, step 3. So if you're a year of graduation more than 2 or 3, step 3 is kind of like unspoken mandatory. You have to get it done. I did get my step 3 result in November, but I didn't clear it. I just missed it by 2 points because I was juggling a lot of things. And so that was really disappointing. And I gave it again. But because if you give your exam in January, you don't get your result until March. And that's beyond the rank order, rank order list deadline. So that was a big, I would say that was a big factor for which I didn't match, because I ticked all the boxes. And even research, since my residency, I've been working on projects and publications. So by the time I applied in the year 2021 for the 2020 match, I did have a good number of publications, around maybe 15 to 16 by then. So the only reason I can say I didn't match last year was because of step 3. But this year, because step 3, I had step 3 and I had 1 fellowship. And after my geriatric psychiatry fellowship was done last year, I again moved into an addiction psychiatry fellowship in the same year, because I was able to continue and I still met the exceptional criteria. And it also gave me a chance to continue my J1 status and also continue working while also, getting US clinical experience. So this time when I applied, I have step 3, that is done. I have 4 US LORs now. That's by the program directors and also 2 attending. So that's more strong. That's a stronger LOR now. And also I've been because I've been doing the fellowships, I've been able to work on a couple of more publications. And also since last time I had those many interviews, so I did get a lot of interview practice. And by this time also my application and also CV, everything was fine-tuned, because before that I joined into Sarthi, and then my profile and my CV, everything was fine-tuned. So I was able to work on that through Sarthi. So that part of it was done. And as part of US clinical experience, I had the fellowship. So I was kind of like ticking out every boxes through, every cycle. So this cycle, I think what worked out, I had a lot of interview practice, because last time I had 6, and also I did some interview practice with Sarthi as well for psychiatry. And for psychiatry, unless you are in the formal interview process, you kind of cannot expect what are the behavioral questions you can get. And when you also have the experience, you don't have to make up cases, or you don't have to kind of like flutter on the behavioral questions, so you know how to answer them. So I think that's really important, that you get the official, even if not the official, at least the proper interview practice, so that you can answer the behavioral questions that you normally expect with psychiatry. So that, I think, played a strong role in all through the interview process. And finally I matched into my top choice. I think that all through the journey, it's been like one step at a time. So but then I'm glad that it's done. I'm glad it's done this year.
Yeah, it's been a story of perseverance and one step at a time, and the unconventional route, but not giving up. So, you really had your share of challenges to overcome. So thank you very much, Nikhil, for sharing that. And
thank you.
Okay, so our last but not the least speaker, Amrita, who's just joined us, and she's running a bit late. But very interesting journey, very few number of interviews, still did her best and matched. So Amrita, why don't you share your journey and some tips with us?
Can you see me?
Yes.
Okay. So hi guys. Nick, okay, I think officially Nick's story, I think is the one I've heard that was somewhat similar to mine. I also have a similar year of graduation. And then I had no plans to move to the US at all. I think people who do home country residency often move because of family reasons or other reasons, right? So I had not written any of my steps. I did orthopedic surgery in India, and I was practicing there. Then COVID happened, and my whole family lives in the US, and they shut down all the borders. So I had to kind of make a decision because we didn't know when the borders would open again. So I just left. So I left in 2020, and then I was at my parents' house. And you know, when you're in your 30s and you're living with your parents, it's difficult. So I was. So anyway, I studied for the exams, and because I wrote my USMLE step 1 within a span of 3 months, and I didn't prepare for it, so my scores were really low. And at that point, I decided I wanted to do private practice. If I was living in the US, I wanted to have my own practice. So I was thinking about internal medicine and family medicine. I also didn't want to go through like a 7-year residency again. So I applied twice and I didn't get any interviews. I have many connections in the US. This is a point I want to make. Okay, I know many people in the US. I have a lot of family. Many people won't help you because they won't understand how bad your circumstances are, how difficult they are. Money is also a big factor for everything, right? Everything costs money. So everything requires a lot of planning. Okay, don't be like me, please plan. If you have to leave, if you're able to stay, if you have to stay in your home country and prepare, then you have to also do a lot of other extracurricular things that make you interesting and stand out. Because they'll want to know what you did all these years after finishing med school, after your residency and all that. So that would be, so you have to be interesting to them. Also, as the year of graduation, you know, the years get more and more, they want to know that you're smart, that you're quick-witted, that you're humble, that you're able to learn. So all those things need to come out in your interviews. One thing that really gave me courage was when Sarthi, they had this thing that you just need one. Because the first 2 years I tried, I didn't get any interviews. I also had to hold down a job. I was doing a fellowship at a large university, and the work was very difficult. It was long hours, and I had no time. And I would breathlessly call Pavan sir and be like, "Oh, I can't talk now, but this is it. It's happening to me. I'm very discouraged. What do I do?" So Sarthi really helped me that way. Sejal's WhatsApp messages were really, I mean, they meant a lot to me. It was really nice. It wasn't like, you know, just like a business. They really care about your journey. And the website helped me so much about picking the programs when I didn't have time. So when you're working and trying to do this, it is a lot harder. But I suggest in the US, there is a culture of work. You work, so when you take long gaps, when you prepare for your exams, make sure you have ways to explain gaps that you do. I know in India, especially, you know, people just take a year off to study, and that's fine. You should do that, but you should have something going on, maybe on the weekend, something like that. Make sure you have a way to fill in those gaps honestly, because they'll ask you questions about all those things, and you should be able to explain it. I used to do a lot of charity work, so that actually did really help me. So if you're preparing from your home country, I'm sure there's a lot of, you know, good things you can do as part of your medical work that may not be something you're paid for. You can do a lot of volunteer work. And then if you move to the US and you're holding down a job, getting rotations through Sarthi, I think, is a very good route to go. Sometimes you just need 2 weeks. So you can ask your boss, can I take 2 weeks off and then go do a rotation? I was not able to do that, but I did try to shadow someone after work on few days a week. I try to do whatever I can. If you have contacts, use them as much as possible. It doesn't always work, and most people aren't like looking out for you because they're not you, right? They have their own lives going on. But be persistent, keep trying. If you've decided you want to go this route, you want to do USMLEs, you want to come here, I think you should go for it. Just be very clear about what your motives are and plan, okay? And I think hard work consistently, despite what your scores are, despite any of all that, is what pays off. Okay, so people see your sincerity, people see your character, And I think all those things really matter. And the good thing about working with Sarthi was they really helped me at a busy time with my CV. And I realized I have so much experience and so many things that I did that they helped me bring out in a way that I hadn't used before. And I'd like to say one point here. Step 3 is extremely important, but because I was working, and this is me very specifically talking about people who are holding down jobs in the US while applying, I wasn't able to take step 3 because I didn't want to fail it. And I also had low scores for step 1 and step 2. I think you should definitely take it, but please make sure you study for it and try to pass it on your first attempt. End of the day, you know, I mean, the universe will work for you in the best way possible. So good luck to all of you. And thank you so much, Sarthi.
Well, thank you, Amrita. This was great hearing your journey, and congratulations again, and good luck for the next phase of your life.
Thank you.
All right, everyone. So now let's move on to questions, and we'll see, what you have. So I'll take it, and then, if of course the panelists, if you want to leave, that's fine. I know it's been a long day. We've been here more than 2 hours. So if you're there, that's fine. Otherwise, I thank you as well. But Amrita, let me start off with you. There are some questions. Why did you switch from orthopedic to IM? How did you explain to the program director? I'm also an old graduate with ortho surgery in my home country.
Okay, so the first year I tried was, I decided I'd worked very hard to become an orthopedic surgeon. And in India, like if you're a female orthopedic surgeon, that's a whole thing. I think there's only like 100 or less than 200 female orthopedic surgeons in India. So that was a matter of pride for me. So the first year and the second year I tried, a lot of people, I mean, my applications were all over the place. Let me just say that. But why did I switch specialty? Like I said, I wanted to go into private practice in the US, and it's not really possible with orthopedics. That was a personal choice. I have had friends who did orthopedic surgery in India and matched orthopedic surgery in the US. I do know people like that. And so it's not possible. There's another route if you've already done a surgical specialty where you can apply for fellowships in, I think, spine and then something else. You have to manage to find these fellowships and do them. There are alternate routes, but whatever the routes are, you need to have a lot of research papers. The person I know who matched had about 30 research papers. He was very well known in India, and very importantly, he had the visa. So if you're not a I didn't have any visa. Like my parents are citizens, but I didn't have, my green card hadn't come through, so I had to apply for J1. It's very difficult getting competitive residencies when you're on a non-immigrant visa. Not that it's impossible, but both the people that I know who got it were already had green cards or were citizens or something like that. Orthopedics, if you live in the Midwest, you can earn about $1 million a year. So, you know, there is a lot of competition for it. It's one of those subjects that is very competitive among American citizens also. So as an IMG, it was, I mean, I realistically thought about it. I think I applied for maybe 10 programs just half-heartedly. Also, it was as a repeat, I'd have to do about 7 years. So I'm in my late 30s, like I said. So I just wanted to do 3 years and, you know, have my own practice. So this worked out for me because these were my goals and I was very sure about what I wanted. It is a challenge. It's definitely harder for surgical specialties, and, you know, it all depends on your priorities. If you want it bad enough, you know, you should go for it.
Thank you, Amrita. I know the panelists have been answering questions, so let me do this. I mean, for those of you, who still have more questions, we'll get to it on the Instagram. By the way, there are discounts running till tomorrow if you want to avail of those for our match plans. But let me go to each one of you to summarize any last minute tips before we wrap up. So as I see panelists on my screen, so Prabhnoor, what is your one takeaway to the applicants? If you were to summarize everything, what should they be focused on?
I think the one thing that I can tell everybody is strategize. Talk to your mentors and strategize. It's not impossible. Just know where you want to land your foot into and then do it that way. And I mean, we all know that the USMLE journey costs a lot. So if you have to spend that much money, spend it wisely on good things that are going to give you returns. So I mean, if you're not that comfortable in strategizing yourself, take up some mentorship course, do something, talk to somebody, but have a good profile that you're confident enough. And a good profile does not only consist of scores. It has to do a lot more than that. Build up your personality and your confidence, because the program directors see through it, and they love confident people who can come up and say things about themselves, and also take headstrong their failures, that I had a failure, but I did that to improve my failure. So just strategize your profile and yourself, and I think you're good to go.
Thank you very much, Prabhu. Jumma, what is your one strongest tip you think that helped you?
So just like Prabhu said, it's just planning and getting the right mentorship at the right time. And if you feel like you're in a limbo and you feel lost, I mean, getting a mentorship program is always a go-go. It's just like, if you have a perfect plan, you can save a lot of time and money, and that's the best bet. And like I previously mentioned, always apply to those programs where you have high chances of matching, and have realistic expectations. That's all that matters. I mean, it's not hard when you look at it, because a lot of people, especially Indian graduates, they are demotivated from applying to the US residency programs because they think that it's a very time consuming, you have to spend a lot of money into it. And that's what I got when I started on my USMLE journey. And, I just, completely ignored them, and I went with my gut, and I finally got it. I matched it in my first cycle. And yeah, pretty much everyone should do the same. And everyone listening to me right now, just be confident. And there are a lot of Indian IMGs in the United States, and you're going to make it. So all the best.
Thank you. Ritika, what is your one biggest suggestion?
I would advise to plan ahead and make a timeline of all things that we all discussed, and do not exceed those timelines, and prioritize like what is important for your profile. 3 points I would like to add, like one of the most common questions that I hear is like, if you have an older year of grad, how you can overcome those filters. I would suggest outreach, excessive program outreaching is the answer. So if the program will see that you have a very good profile without any breaks, they will give you interviews. Second thing I want to add, if you have a low score, do not compromise with the step 3 score. It is very important. Even if you have like low score in step 1 or step 2, and if you land up with a low score on step 3, even if you pass in the first attempt, it will not make a big difference. So get a good score on step 3. And third point I would like, because I also hold an academic research position, and I saw many research questions here. So I would add, make a profile on LinkedIn and apply through all the research positions through LinkedIn. You will definitely get some interviews from there. Okay.
Thank you, Ritika. Anaga, what is your top kind of suggestion?
I think it's a very long journey. So you have to plan well, definitely, but believe in yourself and continue to work hard. It's easy to give up midway, but don't give up. Make sure you have a good mental and emotional support from your friends and family. It's going to be a long and hard journey. So believe in yourself and continue to work hard.
Thank you. Amit?
So I am an older year of graduate 2016. So anybody who is watching this, do not think that we don't have experience. YOG is the most light filter that they use. If you reach out to programs, if you email them, if you tell them what you bring to the table and your experiences, they are going to call you. Planning, strategizing, everything put together, when you get down with all the resources, be it Sarthi, be it the videos that they have and the interview prep, you also need to make sure you are using those resources. Just having them on your hand, on your laptop does not make sense if you don't watch those videos, use them, and plan your journey as to how are you going to answer in the interviews. And be humble. I have heard my interviewers telling me, you have a master's from a university program, but you are still selling yourself short. You have done so much, but you're not talking about it. And I always said, I'm just grateful to have had those opportunities. If you be humble, they see through it and they will recognize that. So that's all I want to say. And having a master's degree, if you have that, tell them why you did it, tell them what you have learned, and tell them what are the skills that you have gained throughout this journey and how is it going to help you with your current field of interest that you're applying for. All those things put together, answer that question very nicely as to why did you pursue those masters, and take a break of 2 years. So that's all I wanted to say. Thank you.
Thank you. Thank you. Rishabh, what is your one parting tip for us?
So I have 2 tips. So the first tip is sit back, relax, make yourself everything clear in your mind, choose your specialty, work on that, because confidence automatically comes when you are clear with the thing what you want to do in your life. So you will proceed with confidence. Don't make yourself wandering here and there and being a confused personality. That will eventually appear when you are interviewing or when you are gaining some experience, and anywhere it will come up. And secondly, I would like to mention that always hear everyone, but don't follow every advice blindly. Ask yourself, do you see a logic behind any advice? If you see a logic and you feel there is a logic, only then follow that advice. Otherwise, people will demotivate you. People will come up with very easy suggestions to follow some easy pathway. But if you decide to continue this pathway, you should, and you should proceed with all your heart and with confidence. That's all.
Thank you. Shaheen, recent graduate, what's your tip?
Yeah, so I would like to say, it's a long journey, and so that you don't feel overwhelmed, you should have small set goals that you want to achieve within this time frame, and make sure you incentivize yourself, keep yourself happy, and once you achieve those small goals, so that your motivation is always high. There will be ups and downs when you're feeling low. You make sure you have a good support system who you can reach out to. At the same time, you need to be very planning ahead quite early on when the residency application ERA submission time comes. You need to have everything in time and practice a lot. Interact with people, not in a very non-medical way. Talk to anyone. If you're in the US doing research or anything, just talk to people and that will help you improve your communication skill. So yeah, these would be my tips.
Thank you. Adil, anything we missed?
Yeah, I know it's a long journey, and as all my friends here who have said that planning ahead is really very important. I will again stress on that. Please plan ahead. And one most important thing, what I also did previously, I would also want to address that. When you reach out to any doctor, when you reach out to other doctors, when you're doing rotations in United States, please don't directly go and tell them that to recommend you into a program. Just talk to them, introduce yourself first, and I'll ask them to recommend you without asking them to recommend you. It's like tell them your journey, ask them what struggles they had when they're going through this process. It will tell them that you're also going through the same struggles, and then they'll try to help you out. So this is one most important tip I would want to give you. Yeah, and of course, consistency and perseverance is the key to this journey, I would say that. Yeah, thank you.
Thank you, Adil. Nikhil, from your perspective, I know you just spoke, but still, what's the tip?
Yeah, I think for psychiatry, communication skills are really important. So whatever clinical experiences you do, make sure that you interact with your supervisors, and those communication skills will be reflected in your LORs. And obviously, interview practice is really important because interviews make or break especially when it comes to psychiatry. So your communication skills and your personality should be apparent in the interview. That is what the programs are going to rank you based on that. I mean, you can have scores, and of course step 3 is also required, but then it's all your personality during the interview session, and make sure that it comes out. I know that a lot of us are introverts and we can't really, be enthusiastic, but then yeah, your personality has to come out during the interviews, especially for psychiatry, because they base their decisions on that. So yeah, step 3, and of course interview practice, and make sure that you put it out there.
Thank you. Thank you. So Amrita, do you want to do the honors to wrap up and say the final word?
Whoa, that's quite a responsibility. But what I want to say is, at the end of the day, guys, everybody, has their own doubts and fears and their own journey. But we're all human, and we all go through all these moments of self-doubt. It's not just about USMLE. There's so many other different things. So don't feel like, especially when you're feeling very scared or confused or lost, just remember that everybody's going through the same journey. It is very difficult for everybody. It is very nerve-wracking. I didn't sleep 3 days before match day. It's like that. My mother didn't sleep. My father didn't sleep. Nobody slept in my extended family. It's like everybody goes through it. So it's a very common experience. But just persevere, work hard, and whatever's in store for you will happen. And if you try hard enough, you can achieve your goals. So best of luck to all of you.
Thank you, Amrita, and my sincere thanks to our panelists. Much appreciate your time and sharing your journey with us. And to our audience, I'll be around for a few minutes to take your questions. But otherwise, thank you again, everyone. Thanks to the panelists. They've been very, very supportive. We've had our discussions in the Telegram group that we all know about, but hopefully it all was in good spirit, and you all got good outcomes out of that. So thank you all, and that is all for today. We will have more sessions like this. So for your questions, etc., if we have missed any, we are on Instagram every Friday. So we'll take those questions. Again, there are some discounts which we are offering till tomorrow if you want to join our match plan. So grab those links, send us an email. And with that, have a very good rest of your weekend, and good luck for the upcoming season. Thank you, everyone, and have a good start to your residency, all the panelists.